Hello and welcome. Today we're going to play detective and decode some of those super common and, let's be honest, kind of worrying rashes that can pop up on kids. The goal here is to take that uh-oh feeling and turn it into, okay, I know what this is. I mean, we've all been there, right? You see a new spot, a weird bump, and your mind just goes there. It's a totally normal reaction for any parent or caregiver. So think of this explainer as your guide through that confusion. Ready? Let's get started. All right, let's open up our first case file. We're calling this one the night itch, and that's because this mystery really kicks into high gear after the sun goes down. So here are the facts of the case. We've got a 5-year-old boy. He's got these skin lesions that are driving him crazy with itching, and it's been going on for 2 whole months. But here it is, the big clue. His mom is starting to get the exact same itchy symptoms. Ding, ding, ding. That tells us we are almost certainly dealing with something contagious. Okay, so take a look at the options. Based on what you know, what's your call? Remember, the fact that it's spreading within the family is a massive, massive clue. If you guessed C, scabies, you nailed it. Now, what's so interesting is that this isn't really a rash in the way we usually think of it. It's actually an infestation caused by a teeny tiny microscopic mite. And that crazy intense itching, especially at night, that's the classic sign. It's your body having an allergic reaction to the mites. And here's the most critical part. So listen up. You can't just treat the one person who's itching. To really beat scabies, you have to launch an all-out coordinated attack. That means every single person in the house gets treated at the exact same time with the prescribed cream. Then you wash everything, bedding, clothes, towels, in hot water to make sure you get any of those little mites left behind. It's a total team effort. All right, let's move on to case file number 2. The pearly bumps. This one's about some weird little bumps that, unlike our last case, aren't itchy at all. But they are spreading. So here's the picture. A 6-year-old girl has these small bumps popping up on her torso and arms. It's been happening for about 3 weeks, but she's not scratching, she's not complaining, they're just kind of there. So what could they be? Okay, detective, time to make the call. What do you think is going on here? Take a look at the clues and the options on the screen. And the diagnosis is molluscum contagiosum. This is an incredibly common viral thing with kids, and it really shows you why looking closely matters. The big giveaway, the telltale sign, is a tiny little dent or dimple right in the center of each bump. It's a feature doctors actually call umbilication. Now, I want you to focus on this phrase right here, benign and self-limiting. So yeah, it's contagious. You can get it from direct contact or sharing things like towels, but the condition itself is totally harmless. And for most kids, you know what the best treatment is? Patience. Seriously, the body's immune system will eventually figure it out and clear the virus all on its own. Okay, for our third case file, the painful dot, we're heading down to the feet. This mystery is all about a single, stubborn spot that's making it a real pain to walk. So here's what's happening. We have an active 11-year-old girl, and she's got this hard lesion on the bottom of her foot. It's been there for 2 months, and it's gotten to the point where every single step hurts. You can imagine that's really starting to affect her day-to-day life. So what's your gut telling you on this one? Looking at the options, could it be a splinter that got in really deep, a simple callus, or something else entirely growing under the skin? This is a classic plantar wart. It's caused by a very common strain of HPV, the human papillomavirus. And the reason it's so painful is because it's on the bottom of the foot. So all your body weight is pressing on it, forcing it to grow inward. Oh, and a key thing to look for, those tiny black dots. They look like splinters, but they're actually little clotted blood vessels. So there are 2 big takeaways here. First, yes, these things are contagious, especially in damp places like pool decks and locker rooms. But second, and this is really important, the majority of them just go away by themselves. It can take a while, maybe up to 2 years, but your body can fight it off. Now, if the pain is just too much, there are definitely over-the-counter treatments and doctor procedures that can speed that whole process along. Okay, for our final section, we're going to switch gears a little bit. We're moving from diagnosing an active problem to the skill of observation. We're calling this the watchful eye, and it's all about learning what to look for when you're looking at a simple mole. Okay, this is a brilliantly simple but really powerful tool that dermatologists use all the time, and you can too. It's the 3-point checklist.
anytime you're looking at a mole, just ask yourself these 3 simple questions. Now, here's the rule of thumb. If you answer yes to 2 or more of those questions, it does not mean it's dangerous. It's just a clear signal that it's probably a good idea to have a doctor take a look.
And that's really the heart of it, isn't it? Knowing when to act is a skill. Just being an informed, careful observer of your child's skin, and your own, for that matter, is one of the most powerful things you can do for your family's health. You know, this whole idea of careful observation brings us to our final point. That skill is now being supercharged by technology, and it's totally changing how we look at skin. Let's talk about the modern doctor's eye. The skin is just unbelievably complex. I mean, there are literally thousands of different conditions, and so many of them look alike. Getting the right diagnosis takes a ton of expertise, a lot of experience, and sometimes a little bit of help. And that help is now coming from technology in a big way. You've got telehealth platforms that let doctors consult with specialists from hundreds of miles away. And you have these incredible little devices, some that can even attach to your smartphone, that basically create a super magnified view of the skin, revealing patterns that are totally invisible to the naked eye. Which really leaves us with this final, fascinating question to think about. As the camera in your pocket gets more and more powerful, and as AI gets smarter every single day, how long is it before the first step in diagnosing a rash isn't calling the doctor, but opening an app? Something to think about. Thanks so much for joining us.